Hi, I'm Tracy, and I'm a wellness director with NIFS in Mystic, Connecticut. And today's presentation is, Am I too old for this? So let's get into it. If I'd known I was going to live this long, I would have taken better care of myself. This is a quote by U.B. Blake. U.B. Blake was known as the father of ragtime. He's probably one of the most interesting people I've ever read about. You'll notice that it says that UB passed away at the age of 96, 98, or 100. Let's look into that. UB Blake was one of the most important figures in early 20th century African American music and one whose longevity made him a storehouse of the history of ragtime and early jazz music and culture. He was born in Baltimore in 1883. Let's go to the second paragraph. Born to former slaves John Sumner Blake and Emily Emma Johnstone on February 7th, 1887. And there the confusion begins. A lot of that has to do with the war. U.B. Blake claimed that he actually was born in 1883, but upon entering the war, he wrote on one of his certificates that he was actually born in 1887, and UB always claimed that the 1887 date was a misprint, and he truly was born in 1883. Either way, we'll never know. But a couple of interesting things about UB was this. Because of the war, he was really not known for a lot of the amazing things he had done. He really didn't meet any of his infamy until his 80s and early 90s. He appeared on the Johnny Carson show many times, and he also appeared on the stage in Broadway for a lot of the musicals that he had written and taken part in. He was very active. One of the things that we absolutely know is that he was passionate about music. And perhaps that was one of the things that led him to live a very long life. If we go back to the quote, if I had known I was going to live this long, I would have taken better care of myself. You see, UB was asked, what was it that allowed him to live such a long life? And UB paused and responded that he had smoked cigars and drank for most of his life. But had he known he was going to live such a long time, he would have taken far better care of himself. That's an interesting quote. He would have taken better care of himself. So basically, he finished the marathon, but he really wasn't enjoying how his body felt. That's something to keep in mind as we go through this. So let's look at the Dallas Bed Rest and Training Study in 1966. It started off initially with 6 students, all males, and one of them ended up dropping out once he heard that they were going to be drawing his blood every single day. He wasn't a fan of needles and immediately left the study. However, 5 of the gentlemen remained in the study, a study that I find fascinating. This is what it consisted of. The study would proceed in 3 stages. The first one was a complete evaluation of cardiovascular and pulmonary function, plus electrolytes and blood work. A 3-week period of bed rest. Everything that they had to do had to be done from bed. That included using the restroom and eating all of their meals. This was followed by an 8-week training period of mostly running, after which stage 1 would be repeated. Very interesting. The Dallas Bed Rest and Training Study of 1966. After it was conducted, the period of bed rest, all 5 participants experienced a dramatic loss in exercise capacity and cardiovascular function. After 8 weeks of intensive exercise training, the 5 20-year-old men were able to recover and surpass their original level of aerobic fitness. Think about that. They surpassed it with 8 weeks of training. That's incredible. Once this study was published, bed rest became a thing of the past for post-treatment of heart attack, surgery, and many other medical conditions. You see, before that, when somebody had had a heart attack, they were hospitalized, or had they had heart surgery, both times or both incidents, they were told to stay in bed and recover. One of the things that we know now is by staying in bed because of this study, you were actually creating more deconditioning. You were doing the patient a true disservice. This also goes for things like having a back surgery. Oftentimes, after having a significant back surgery, you often have somebody coming into your room and asking you to get up and start walking around, almost to every patient's dismay. This is something to consider as well if you come down with something like the flu and it has you bedridden for a few days. Oftentimes you may observe even in yourself that you don't feel quite right getting up and moving around again. It might be because of the flu or any other disease or illness you may have come in contact with. But the reality is deconditioning is a rapid process, and this bed rest study truly shows that. So what do we know? We know that these 5 gentlemen were asked to come back 30 years later. The 5 original study participants were all now men aged 50 to 51. Measures of their aerobic and cardiovascular fitness were taken again. Baseline fitness levels were similar to the fitness levels they had experienced after 20 days of bed rest 30 years earlier. So look at that. What we know was for 30 years, they were deconditioning to the point that they were after that long weeks of bed rest, those 3 long weeks, they began to decondition. And 30 years is a long time. And to consider that those 3 weeks of bed rest were equivalent to 30 years of aging is an interesting component. It really changed medicine and the way that patients were treated. Following this baseline evaluation, all 5 entered an exercise training program tailored to their individual interests. And you'll notice that I highlighted that. The thing that I want people to understand is that not every exercise is suited for every person. It has to match your interests. Not only that, but you want to start a program that you actually enjoy doing. 2 men entered a walking program, 2 a jogging program, and 1 a cycling program. Their exercise was gradually increased to the level of duration and intensity of their 1966 exercise programs, to between 4 and 5 hours of exercise a week. That's it. That's not a great deal of time. 4 to 5 hours a week. We can all figure that out and fit it into our days. After 6 months of moderate aerobic exercise, all 5 had restored their aerobic and cardiovascular fitness to the baseline levels they had enjoyed 30 years earlier as healthy 20-year-old men. So take a moment and think about that. 30 years of aging were then improved upon through exercise. A 6-month program, moderate intensity, and doing something that they all enjoyed doing, tailored to what they enjoyed. That's important information. It not only changed their cardiovascular fitness, but their muscular ability as well. And that's something we should all want. So here's the conclusion. 20 days of bed rest has the same effect on cardiovascular fitness as does 30 years of aging. With as little as 6 months of moderate aerobic exercise, middle-aged individuals can reverse the effects of decades of aging on cardiovascular fitness. People oftentimes say to me when I talk about this lecture, "Am I too old for this?" Why would I name it that? And the answer is simple. Sometimes I'm working with somebody and I'll say, "Well, let's get down to the floor now." And they often respond to me by saying, "I'm too old for that. I don't do that anymore." And I look at them and I say, "Well, when do I stop doing that then?" And they usually look at me rather perplexed. And I say, was there an age where you were supposed to stop getting down to the floor? Because the honest answer is this. If you are at great risk for experiencing a fall, there's probably no better strategy that we could talk about and teach you to do as getting up from the floor. So getting down to the floor safely is just as important as it is to safely get back up from the floor. So my response to, am I too old for this, is we should never be too old for anything. There's always a way to figure something out. But more importantly, let's go back to the Dallas bed rest study, because not only did they do a 30-year follow-up, they also did a 40-year follow-up, 10 years after the 30-year. And let's look at that and see what happened. Not only does the Dallas Bed Rest and Training Study of 1966 demonstrate cardiovascular fitness is important, it slows the process of hardening of the arteries, reduces the risk of heart attack and stroke, it keeps your weight down, it reduces the risk of developing diabetes, reduces LDL cholesterol, which is your bad cholesterol, and triglyceride levels. It also increases your HDL, which is the good cholesterol. It also points to the fact that over time, these people can expect the same type of cardiovascular deterioration seen in young, healthy people who are placed at 20 days of bed rest. Their decrease in cardiovascular fitness makes them physiologically at least decades older than they are. Exercise might not actually be the fountain of youth, but it truly is the closest thing that we have to anything at this point. The 40-year follow-up of the Dallas Bed Rest and Training Study pointed to the effect of age on the cardiovascular response to exercise in men. These same 5 men. They went and found them 10 years later after the 30-year follow-up, and they said to them, we want to look at your cardiovascular fitness again. These results are probably the most interesting, because we were looking at gentlemen 10 years earlier who were in their 50s to what they were doing now in their 60s. When we looked at participant A, who was a sedentary participant from the 1966 study, in 2006 he was being treated for hypertension and high cholesterol. He had not performed regular exercise for more than 20 years prior to the 30-year follow-up, but was performing resistance training 3 days a week for 2 years prior to the 2006 study. He had experienced body weight and body fat increases between 1966 to 1996 of 12% and 75% respectively, but they remain unchanged since. His cardiovascular endurance was significantly attenuated between 1996 and 2006. So when we're looking at participant A, who is typically always sedentary, even something as simple as resistance training, only a couple of days a week, seemed to impact any decreases, at least significantly, in his cardiovascular function. So something small as that, had an impact. It didn't stop any of the hypertensive qualities he developed as he aged, though. And that's important to identify because participant A, admittedly, was always sedentary. Participant B was the one he ran 75 miles weekly before the 1966 study and continued a regular training program until 1996. He took no medication and was healthy at the 40-year follow-up. Very interesting. Between 1996 and 2006, he maintained his training program, replacing running with upright cycling, and performed regular interval training. The significant body weight and body fat gains between 1966 and 1996 were annulled between 1996 and 2006. So participant B, during the 30-year follow-up, had gained a lot of weight from 1966 until the 30-year follow-up. So I think he got the message at the 30-year follow-up that he needed to watch what he was eating. he needed to maintain a lower body fat percentage. He really heard the message and made those changes. So at 60, he was taking no medications, had lost the weight, and he had also reduced his body fat. Those are important things to keep in mind as we age. And it was all through exercise. So he changed what he was doing from the standpoint of running to something that he was able to do, cycling, and it made an impact. Participant C had participated in high school athletics, but was otherwise sedentary prior to the 1966 study. During the 30-year follow-up, he had intermittently jogged and pedaled a stationary bike. Prior to the 2006 follow-up, participant C was not taking any medications and was cycling 3 days a week for 30 to 45 minutes on a recumbent cycle. During his screening visit, he developed AFib, was treated medically for 6 weeks prior to performing any of his maximal exercise testing, at which time he was in a normal sinus rhythm, which is what we want. In the 10 years following the 1996 visit, he had lost weight and decreased his body fat by 7%, and his weight dropped by 22 pounds. So participant C was historically a never person to exercise. And during the 30-year follow-up, he also kind of got the message that exercise was important. So those 30 years that he really didn't invest too much in exercise, he really got the message. And then at the 10 years following the 30-year follow-up, he began to exercise, and it made a difference. But what's important here to notice is that he did develop AFib. So perhaps we can look at the point that exercise does help to keep your heart healthy. Now, participant D was sedentary prior to the 1966 study. He played soccer in a semi-pro league intermittently between 1996 and 2006 and had recently taken up cycling 1 to 2 days a week. He was diagnosed and treated for hypertension. During the 2006 testing, he developed AFib that was resolved medically within 1 month. During the 10-year interval, his weight and body fat remained unchanged. So participant D experienced the exact same thing. He didn't really take such great care of his heart or his bodies for the 30 years. But when they did the 30-year follow-up, the message stuck. And for the following 10 years, he was able to maintain a healthy weight. He even lost a few pounds and was doing better. Participant D got the message that exercise was important. Participant E had played football at both the college and semi-pro level in 1966. He had been lifting weight 2 days a week prior to the 1996 study, but was completely sedentary prior to the 2006 visit due to severe lower back pain. Since the 1996 visit, he developed hypertension and was being treated medically. He had lap band surgery and therefore experienced significant declines in body weight from 1996 to 2006 when the 40-year follow-up took place. He was given an MRI to determine the cause of his low back pain and was ultimately diagnosed with metastatic renal cell carcinoma. He also experienced huge declines in cardiovascular function due to his extreme sedentary lifestyle. So participant E had some things occur to him that really negatively impacted his health. But he too got the message at the 30-year mark. What I think all of the participants experienced at that time was the importance of exercise, especially in their 50s, when they were given a program of both muscular and cardiovascular endurance that was tailored to meet their needs, things that they enjoyed doing, things that they were capable of doing. And when they saw that they were able to turn back time in a sense and get their bodies back to that maximal function back when they were in their 20s, they all got the message. And at that 10-year follow-up, they were all able to attenuate any of the declines in cardiovascular function to a certain level. What was interesting too, the people that were the least active were the people that became hypertensive, people that developed AFib. But what's even more important was that at the age of 60, they were still turning back the hands of time in a sense. They had all gotten the message that exercise was key to living a really well-balanced life. Here's some facts about aging and exercise. According to the American Journal of Sports Medicine, the literature strongly suggests that the greatest threat to health is not found within the aging process itself, but rather in inactivity. That's an important message. Being inactive contributes to really poor aging. That's a message we all need to hear. Older people who are active often have faster muscular movement than younger people who are sedentary. Now, why is that important? The reality is we all trip the same amount. So if there is something lying in the middle of the floor, what's important to know is a 20-year-old and a 60-year-old will both trip over the same item. But as we age and our reflexes begin to decline, that can be offset by exercise and having the muscular strength to stop a trip from turning into a fall. The decline in muscle strength beginning in your 30s does not begin to decline until your 60s with aerobic exercise. Resistance training is even more effective. The best approach is to combine the two types of workouts, and it's never too late to start. You're never too old for this. Active people have lower heart rates and experience only 1/3 the aerobic decline of sedentary people. A year of regular aerobic exercise can increase the heart function of people in their 60s by 25 to 30%. And that 40-year follow-up really points to that effect well. Regular physical activity has beneficial effects on most, if not all, organ systems, and consequently, it prevents a broad range of health problems and diseases. Physical activity in older persons produces 3 types of health benefits. It can reduce the risk of developing chronic diseases such as heart disease. It can aid in the management of active problems such as high blood pressure, diabetes, obesity, or high cholesterol. And you can see in the 5 participants, those who didn't exercise were the ones that developed those types of things. They developed high blood pressure. They developed high cholesterol. And those, in particular, one of the participants who was really devoted to exercise was the only one that had no medical issues and was taking no medications. Exercise can improve the ability, the function, and stay dependent in the face of active problems like lung disease or arthritis. Think about that. They can stay independent in the face of those active problems. Exercise is powerful medicine, and that's the way we should all look at it. I want to circle back to one thing. The fact that U.B. Blake was a person who never exercised. He admittedly said that. But the one thing that U.B. Blake absolutely had was passion, a passion for life. He lived to be into advanced years, whether it be 96, 98, or 100. But the fact that he said, had I known I was going to live this long, I would have taken better care of myself. Meaning, he would have taken better care of the house that he was living in, his body. The Dallas Bed Rest study really points to the fact that we're never too old for anything in life. If you have questions about exercise, you can go to the NIFS Wellness website looking for answers, or talk to your NIFS professional. Thank you for attending this webinar. Have a great day.